Brilliant, thanks. Like I said, because we're sharing our slides, we can't see everybody, nor can we see ourselves. So yeah, that's great. Okay, welcome everybody. So this is a talk around personal health budgets that we have been very fortunate in Calderdale to receive through the ICB. And when I say we, it's Open Minds CAMHS. So let me just, sorry, I'm trying to move the slide. There we go. So yes, so I'm Jo Marshall. I'm the Deputy Manager for Open Minds CAMHS at North Point.
And I'm Sarah Nichols. I'm a therapeutic practitioner for Open Minds.
So Calderdale and Open Minds CAMHS is a partnership of organisations who are commissioned to deliver CAMHS in Calderdale. And so that's made up of North Point, which is ourselves, South West Yorkshire NHS Partnership Foundation, sometimes trust known as the SWIFT, and Invictus Wellbeing. Okay then, so for the next 20 minutes or so, Sarah and I are going to talk through how we've promoted and implemented personal health budgets across Calderdale Open Minds CAMHS. So Open Minds CAMHS work with children and young people 5 to 18 and giving interventions around supporting our mental health. We're going to share some of our real stories of how children and young people have achieved specific goals and outcomes by receiving these small but life-changing pieces of identified equipment or activity, and how they can then self-manage their mental health and well-being. So that bit's going to be done by Sarah. So just a reminder is a personal health care budget is a sum of money to help purchase service, support activity, or buy a piece of equipment that will help individuals achieve better health and well-being. So today we're talking about this pilot, this money that we have been given, so it's specifically around children and young people 5 to 18. Okay, so Calderdale Open Minds CAMHS have worked hard to implement a robust and effective process that children and young people can lead on with support by their therapeutic practitioner. Through this pilot, our main vision was to raise awareness and enable children and young people increased choice and control around their personal health care. So this is specific to children and young people, like I've already mentioned, and it's when an additional need is identified which goes beyond a therapeutic offer. So an intervention that our Open Minds CAMHS practitioners would be supporting a young person on. So we promote the importance of intervening early and building long-term resilience in supporting children and young people to purchase identified equipment and, like I've already said, or positive activity that can help personalise their mental health care. And I think that slide just then said about the importance around engagement. It's absolutely considered a priority when applying for a personal health budget. It's discussed in detail with the therapeutic practitioner and with the child or young person, and it's really important that they take lead because it's about their own personal recovery to better their mental health. So we've engaged stakeholders, so that's lots of other professionals around Calderdale from the mental health sector, and we've done that through vigorous sort of promotion, really. So we've done things like we've shared information about personal health budgets in team meetings, we've delivered workshops, and we've also held a really successful celebration event to colleagues, like I've just mentioned. And from that, from professional side of it, we gathered some really qualitative feedback about the process, and we've been able to demonstrate that by really listening to practitioners, to professionals, and really implement some positive change. So one of the things that we've done here in Calderdale is we've made the journey pretty seamless by having all the documentation online, and that's from the promotion of the personal health budget to approving the personal health budget and then purchasing it and actually passing it on to our children and young people. So how that works in a nutshell is, like I've explained, we've got children and young people who are already in intervention with Calderdale Open Minds CAMHS. So that's one of the practitioners. Again, like I said earlier, through it could be through our North Point staff, it could be through Swift staff, or it could be through Invictus staff. And so, like I've said, the personal health budget is led from the child and young person, and it's supported by the practitioner. So the practitioner would make sure that the young person understood what the personal health budget is and what it, what it can be used for. So that application is, like I said, done co-produced, and it's then submitted and signed electronically. That then goes to a panel member. So the panel members in Calderdale is it's Pete from Parent Carer, who is a Parent Carer Family Voice Calderdale. So Pete's a rep on Family Voice Calderdale, which is part of Unique Ways. We've got Helen Shepherd, who is a senior lead nurse for children and young people. Now, Helen's just recently retired, so we're actually going to be having a replacement for Helen, but I've used Helen because that's who we've been doing it until she's just retired. We've got James Robinson, who's a team manager for the medical needs team, and then myself, deputy manager for Open Minds CAMHS. And what we do is each panel member reads the referral and either approves it or declines the application. Now, if it was to be declined, then that information would be shared with a practitioner who would then explain the reasoning to the child or young person. If it is approved, then the form automatically then goes to our admin team here at North Point, who then orders the equipment. And again, the practitioner will at each stage share where that process is, that application is. So once it's been ordered and it's arrived here in Commercial Street where we're based, the therapeutic practitioner will then get notified in the piece of equipment here, and they then arrange for that piece of equipment to be passed on to the child or young person. So it's pretty seamless, which is great. So in total, we've approved probably around 80 personal health budgets, and there are various amounts of money. We do have a cap on our amount, which is £500 per application, but often we get small amounts of costs where it might only be like £10, £20. But then, like I said, we've also had some a bit higher than that as well. So I'm now going to pass you on to lovely Sarah, who's going to talk through what type of equipment has been purchased and some real stories.
Okay, so in terms of PHBs and the things that I've applied for, I've often been around emotional regulation or helpful distraction strategies, because in terms of therapeutic sessions, we're obviously processing, working through anxiety, looking at cognitive distortions, helping challenge them. But sometimes that's really difficult for a young person to do. So then we're looking at what else can they do to help manage their mental health. And this is usually towards the end of the work, because sometimes you need to get to know the child quite well. You need to get to know what, and they need to get to know, more importantly, what works for them. And then you have a discussion with the young person, and I explain it's a grant process. I explain it has to go to a panel. I explain it has to be approved. So it's not as if, oh, you're going to get this. This is really clearly spoken about to the young person. And in terms of the form, it's quite simple. It's quite simplistic form. It doesn't take too long. It's literally, you are very specific about the young person's mental health, what the difficulties are. You then, on another column, put the items that you're requesting, and then what you hope that the young person would be able to achieve by using them. So examples of PHB things I've often ordered. Ear loops is one of the most popular, obviously, for sensory difficulties. Art and craft resources, book vouchers, sometimes audio books, and like echo dots, so they can listen to the stories. I've had overhead projectors for a night time. So it's it's very personalised to the young person. And it's about looking at how they're going to use it. An example could be also skateboards or a bike. It's about them working with them to find out what works for them, because we don't want to buy resources that are just going to be left in a cupboard. I'm just going to discuss about some case studies, just to let you know. I have spoken to the people about the case studies. No names will be mentioned. I had one young person who was 9, and this young person had ADHD traits, currently going through the process. So within this young person's sessions, I noticed she was quite active. So we ended up in the room being quite active and using footballs and yoga balls while we're doing the therapeutic work to keep her moving. And through that work, we were able to identify what the traits were. We called it Tigger. So when our active Tigger was becoming quite active, and we then used a yoga ball in the session. So anything was quite difficult to talk about, she used to sit and bounce the yoga ball. And as the sessions progressed, I spoke to more young person about the items that they would find helpful. And obviously the weather of quite recently hasn't been the best. So this young person goes out a lot. So we had to find things for allow her to do inside. So what we found was different things to help her manage at different times. So the yoga ball we purchased when she was feeling quite anxious and stressed and wanted to talk about her problems. An indoor basketball, because she just had to be on the move all the time. And then we also purchased some book vouchers for her to be able to then, when she needed that downtime, that quiet time, to be able to read. And then also ear loops to help her around and about when she's going out socialising and being in busy environments. So the idea for her was to get to know herself, to get to know what her difficulties were, and then to get to know what would be helpful at what point. And in terms of this young person, it was about teaching her these are things you can do, and you can do these independently. And we've had some feedback, and this is what's happening. In terms of trauma, items which can be useful can be overhead projectors for a night time. So obviously sleep can be very affected, especially if someone's having difficult memories. So overhead projectors where they can look at something, or audio books so they can listen to something to help them get to sleep, because obviously sleep is a difficulty. If you're not sleeping, then you feel anxious, then you feel low, and then it's that onward cycle. So those are the type of items that have helped to, and also in terms of like arts and crafts and materials like that as well. So those in terms of those two aspects, that's what I've ordered and requested, and has been successful. The main thing I would say that when I'm purchasing PHBs, I look for sustainability and access for young people, because it's about making sure that they can manage this after the therapeutic work, and making sure that they've still got access to items, because obviously art and craft items run out. They've read books that they may read them again, but they won't be able to keep reading them. So it's about thinking about what items you can order or purchase where they can get them independently. So library books, or in terms of arts and crafts, there are some cheaper shops which they can purchase. They can put it on a birthday request list. If you're looking at gym membership, because that has come up, what then I look at is a discussion with the family. Because again, gym memberships are expensive, and they're expensive to sustain. So how is that young person going to keep doing that afterwards? Mm-hmm. So that's kind of, can the family be able to, can they do a pay-as-you-go, or can the family continue that membership? Or is the young person old enough to have a part-time job and they can pay for that themselves? Because the last thing you want to do is give them something like ballet lessons, music lessons, gym membership, and then they can't continue, because then the young person could really miss that and then become quite down within themselves, and also it could cause some difficulties within the family. So it's about, if you're thinking about certain bigger items like those, how is that going to be sustained for the child, the young person, and also how can the family manage that without an additional pressure? And in terms of PHBs, and what I really like about them is therapy is only for amount of time. And as a therapist, especially if they've been through a lot of things, or if this thing's still ongoing, we can only process so much at that time. We can only do so much. It's almost like a raindrop, and you can reduce the raindrop, but the ripples upon it can be very difficult. So it's about helping them manage the ripples and what are they going to do and how can they do that, and also helping them understand that they're not hopeless in this. They can use their own autonomy and be able to put things in place to help themselves. So I really like the PHBs. I do feel that it's been a very useful thing. I've had some good feedback in terms of ear loops as well, young people in high schools especially. It makes it more manageable, and schools have been very responsive about those and allowed them to use them in schools. When the teachers are delivering the lesson, sometimes they have to take them out, but when they're on busy corridors or when they focus work, then they can use them again. And they've actually said it helps them feel less anxious going to school. So it's then that if they feel less anxious about going to school, then you may stop other problems from developing. So I'm a big fan, basically. So yes.
Thanks, Sarah. Okay, so yeah, just from hearing what Sarah's just explained then around what's been already purchased, it is low cost, and so therefore, you know, the amount that is used today we know that it's had a positive impact. But what we now need to do is evaluate that impact and share that with people. So from June onwards, that's going to be our sort of focus here in Calderdale. And how we're going to do that is we actually have got the admin team to support us with that process, because they don't have a therapeutic relationship with that child or young person. They would be best placed to then contact that family, contact that child, young person, and find out how their PHB has impacted them. So thank you very much for listening, everybody. So that's PHBs in Calderdale.
Thanks so much. That was really interesting. I'm going to open up the floor a bit for questions, if that's all right with you guys. Janine, got your hand up.
Hi there.
Hiya.
Hi, Jo.
Hiya. Hi, Janine.
Apologies, I missed the very start of the session, so if this has already been covered, sorry about that. But my question is, so there's some confusion because personal health budgets is a term, it's something that you can access through lots of different routes. So I just wanted to be clear about the funding route and how you would request this as a family. I'm thinking about how I would signpost families in the National Autistic Society branch. So my understanding was that personal health budgets are something related to continuing healthcare. So that's a very, a quite high level of need. Yeah. So I'm assuming it's different to that. And then also you can have personal budgets through EHC plans as well, can't you? And from what I'm hearing, this is different to that as well, isn't it? Have I got that right?
Yes.
Do you want me to come in? Sorry, I was going to say, do you want me to come in there?
It's all right, Michelle. I think, so basically, Janine, that we're here today to talk about a pilot that we got given an amount of money to support children and people's mental health through CAMHS, so through our children and adolescent mental health service. And so that for those children who come through to us and receive an intervention, and it's those children, and that's what we've just been talking about. So I'll pass you back to Michelle, but I'm fully aware, and I'm not sure if everybody is fully aware, that there is personal health budgets, and it can be accessed through various routes. But today we were just talking about our children and young people within Open Minds CAMHS in Calderdale.
Thank you. That's that clarification, because it is confusing when it's a term that's used across different areas of the NHS and social care and whatever. Yeah.
Hi, Janine. My name is Michelle Bennett. So I'm a programme manager working with West Yorkshire ICB. So I'm a palliative end of life care and personalisation programme manager. You're right, there are lots of ways and lots of terminology, and we kind of use this term PHB quite loosely sometimes. There are PHBs which are for those legally entitled. So those are people that you're talking about around CHC, wheelchair users, and people with mental health section 117 discharged from hospital. So they're the people that are legally entitled to a PHB. What this is almost a well, it is very different, and this is around a one-off PHB. And there's lots of incentives across the country around this one-off PHB. The NHS hasn't got an endless pot of money, unfortunately, so we're having to do things smarter. And this was just a project, so it was a one-year project where a small amount of money was awarded to CAMHS in Calderdale, and as Jo has just discussed, really the process that went with this. What we've actually found from a West Yorkshire perspective, because we're actually writing a policy on those legally entitled at the moment, is actually there's pockets of this going on all over, not just in West Yorkshire, but actually all over the country. Some of them fit under one-off PHBs, other people are calling it discharge incentives or emergency avoidance incentives. So it's really difficult when we're all calling it different things to kind of understand what they are, but this is definitely around just a one-off PHB. It's not a continuous service, it's a one-off purchase for something